bad.
Ooh, look at that one.
Oh,
There you go.
perfect.
Yeah. You know what they do? Came from a very poor background and been successful in business and fortunate enough to have a wonderful family. We have a lake house in Michigan, and it has always been our place for family and enjoying life. Also have an orchard, and we set it up. We have pears, we have plums, we have apples, and I probably have 12 different kinds of apples in the orchard. We have 160 trees in the orchard.
Some good ones. You driving?
But one of the major, most fun things for myself and my daughter and my granddaughter is to go up on the hill and pick apples or fruit off of the trees. That was kind of what the whole place was designed around, and we just enjoy the heck out of that.
I think this is a pink lady. Mm-hmm.
Think so?
Uh-huh.
The first notice that I had was blood in my urine, and immediately I knew I had a problem, so I went to my regular doctor, and family doctor, and he immediately had me sent out to a urologist and had a test. My name is Duane, and I have bladder cancer. The one thing that happens, and it happened to me, when you hear you have cancer, you don't hear anything else. You just hear you have cancer, and you think the end is near. In my first case, where I had just had stage 1 bladder cancer, I wasn't shocked by the diagnosis because I smoked, and I knew I was going to come down with cancer at some point in my life, but it's still the C word, and you have to put it in your heart that you do have cancer and it's threatening.
And the most common risk factor for bladder cancer, unfortunately, is smoking. It's actually the 4th most common cancer in men, much more common in men than in women. It is a disease of older individuals, so the risk increases as you age. The most common symptom or sign that patients will present with is gross hematuria, meaning they can see blood in the urine. Most of the time, it's painless. I think if there's something that I can communicate that's maybe most important about all of this is that a patient should not ignore that. If they see blood in their urine, you need to have that evaluated by a physician. Sometimes patients can have what we'd call irritative voiding symptoms, which means the patients can complain of having to frequently go to the bathroom, feeling like they're not completely emptying, having to wake up at night to go to the bathroom, pain with urinating. These are other symptoms that can sometimes occur.
I went back to Kristen, and she said, Dad, I'm going to research it, and I'm going to find somebody that can do all of the things that we need to be done, and that will help us.
When my dad was first diagnosed, he was diagnosed with stage 1, high-grade, non-muscle invasive bladder cancer.
We all have a muscle layer of our bladder that allows our bladder to squeeze when we need to pee. If the tumor has not yet invaded the muscle, we call that a non-muscle invasive bladder cancer. That's an early stage bladder cancer. If your cancer has invaded into that muscle layer, this increases the risk of that cancer significantly, and the treatments that are directed toward it become much more involved and complicated for a muscle-invasive bladder cancer, because those cancers do put patients at risk for spread to metastases.
3 years, I went through treatments and a number of different procedures, and at the end of that, I thought everything was great. Lo and behold, about 2 years after I got off of the treatments, I was having severe pain in my stomach, my lower groin area, and I knew that I had a real big problem at that point.
The cancer returned, only this time it had metastasized, coming back as a stage 4 bladder cancer. And that's when we found Dr. O'Donnell at University of Chicago.
So this is bladder cancer that has spread outside the area of the bladder to other organs. The prognosis for these patients has historically been poor. And for many decades, the only treatment that we had available for these patients was traditional chemotherapy. It's really an exciting time, and it advances in the field of bladder cancer. In Duane's case, we had an interesting choice to make. He came along at a time when some of these new agents were being explored in bladder cancer.
Dr. O'Donnell was great with the play-by-play. He let us know what to expect. He let us know what side effects to anticipate. He really knew what to share and when to share it. You know, my dad was in such excruciating pain when we found ourselves at Dr. O'Donnell's doorstep. And he was convinced that after one treatment, my dad would feel some relief. And we thought, oh my gosh, how is that even possible? But sure enough, it was true. It was really, truly unbelievable.
I'm just going to listen on your lungs, okay? Breathe for me, in and out.
By the 4th treatment, we went in and looked at the scans, and as I say, it was the size of eraser on a pencil. And Dr. O'Donnell was really excited. I was really excited, and Kristen was probably the most excited of all of us.
I give Duane a lot of credit. He was very brave. Some patients, are courageous enough to go on to clinical trials. We view that as a way not only to potentially bring new treatments, really hopeful treatments, to patients earlier, right, before these treatments are approved, but also as a way to advance the field and help patients down the road. And in this case, it's exactly what happened.
So, where are we at now?
Yeah, let's look at it. So I know you had another scan today. Okay, we're looking at these areas of the lung that we've been following where there's some of that inflammation there, and it's looking pretty good.
Doesn't mean I have to go back to work, does it?
My dad is the most generous, giving soul you will ever meet. I mean, when you talk about a good guy, that is my dad. I am so proud to be his daughter and to be by his side through this journey.
My support group is my family. They have been totally supportive of this journey that I've been going on and have done everything possible to make it more comfortable. Fortunately, Kristen has taken it upon herself to help me and direct me and guide me through all of this, and I can never be more thankful to anybody than I am to her. Everyone needs someone to be there for them. I can't imagine having gone through this alone. I don't think I could have made it.
My goal and my mission for my dad and for his well-being was to find the best that was out there, to leave no stone unturned. I think half the battle with a diagnosis and dealing with an illness is knowing you're in the right hands.
I like this one.
I like that one too.
Nice little bouquet.
I don't know how you guys manage to take care of so many beautiful flowers.
One of my goals was to walk my daughter down the aisle. We've accomplished that goal.
There's no greater gift than to see that moment. It brings a tear to your eye.
My next goal is to make the graduation of my granddaughter. She's a sophomore in high school, and I want to be there for her graduation from high school. So we're not taking a long-term approach to things. We're kind of taking it off in chunks and bites and trying to move forward and not put unattainable goals out there. So I've been blessed and fortunate to be around and available and relatively free of side effects and free of any bad situations to my health.
One of the things that this bladder cancer has done for my dad and myself is we've set time aside for each other. It's more of a gift almost to me than it is to my dad to have that opportunity to give back to him.
In Duane's case, his prognosis right now looks very promising. He responded to the initial treatments, and so right now we're following him with CAT scans to make sure there's no signs of that cancer starting to grow again or spread.
After 3 years of his recurrence, his cancer isn't curable, but it's treatable. The quality of life that he has in this durable remission is given him an opportunity to be up at his lake house, to be in his garden, to be in the orchard, to do all the things that he's been waiting so many years to do. So I'm looking forward to sharing that time with him, to watch him enjoy his life and relax. It's time.
My prognosis has been very good, but I rather look at whether what I've gotten from the last number of years as positives, and every day, I look at every day as a slice of gold. Every day that I get up, I've got another slice of gold. That's what it's all about. That's time with your family, and those are those golden slivers that I have, and I'm still enjoying them. I'm the luckiest guy in the world.